The most important thing, I think, is really about the general sort of systems in the body as well. For example, the cardiovascular system. If people are undernourished, then the cardiovascular system will suffer. Their blood pressure will fall. Their pulse rate will fall. In other medical conditions where the heart is struggling, the blood pressure will fall, but the pulse rate will go up in order to try and compensate. But in eating disorders, you get the situation where the blood pressure is falling, but the pulse is also very low. And this is actually quite characteristic of eating disorders. So if your blood pressure drops when you stand up, especially by more than 20 millimetres of mercury, and your heart rate goes up by more than 25 beats per minute, that's telling you that your cardiovascular system is not coping with the nutrition that is being provided. So that's a very important red flag that there's something very, very wrong. Body temperature is another system which is also very sensitive. If nutrition is so low that insulation in the body starts to drop, the body temperature will drop as well. So we're looking at these sort of things to do with sort of vital, what we call vital signs, and they're vital because they're so important to life. The other thing is blood test results. Certainly we look at ordering different types of blood tests. It's very important to look at things like the full blood examination. Hemoglobin is one thing which can tell you that if it's low, that they're not getting enough nutrition, but also the white cell count will often drop if people are undernourished as well. So we have sort of red flags that we look at. We look at the full blood, the blood sugar, which often is very low. We look at the kidney function, the liver function. The kidney function is very important, particularly in cases of bulimia, because often because of vomiting, people lose too much potassium. It's that simple. It's just a matter of the fact that potassium is being lost. And so a low potassium can alert us to the fact that somebody may be vomiting. Also, using laxatives will have the same effect. So looking at the potassium level, sodium level, liver function tests, thyroid function tests will often become very abnormal. Magnesium, phosphate, zinc, all of these very important essential minerals become disordered also. And so there are sort of criteria that we look at that tell us when the situation is critical, when we know that the patient is in danger of dying. And in that situation, as in every other situation as a doctor, we need to send that patient to hospital for further tests and so on.